The Trump administration's efforts to limit federal spending have raked through dozens of national agencies.
And most recently, talk of cutting the HIV division at the CDC has advocates and healthcare workers wondering about the future of their services. Our Maddie Heimsch reports.
Here in Wisconsin, we received $1.9 million of the federal CDC funds that are going into prevention for HIV.
$1.9 million worth of HIV education, treatment, and prevention services. Services that Vivint Health Chief Advocacy Officer Bill Keaton says are working.
They're effective. They're helping to reduce the number of new HIV diagnoses and the number of transmissions that are taking place. Any disruption to that is going to be catastrophic.
Keaton says over the past 5 years, new diagnoses have come down by about 12%.
We still have a lot of work to do to make sure that folks who are coming from Black and brown communities and the LGBT community are getting access to the programs and services they need.
According to the Department of Health Services' most recent report, racial and ethnic minorities made up just 18% of the state's population, but 67% of new HIV diagnoses.
In these marginalized populations, there's so much stigma.
Tara Stangler with the Outreach LGBT Community Center says the added stigma could hurt just as much as lost dollars.
And we cannot let funding like this go because it also increases stigma, and stigma causes death for a lot of folks.
And if those dollars are pulled from clinics and resource centers around Wisconsin,
the reality is that there aren't a lot of other good options. State and local health departments don't have the resources to fill these gaps.
Keaton says without the funding, research and prevention for the disease could regress years or even decades.
We're going to see the number of deaths attributed to HIV increase at a time when we should really be talking about eliminating HIV transmission and making sure everyone with HIV can live a long and healthy life.
Reporting in Madison, I'm Maddie Heimsch, News 3 Now.